Hi, I'm Deb Bradfield. I'm a licensed clinical social worker. I started school at Pueblo Community College, and I started as a late student. I was a divorced mom of 3 kids, and they walked me through it, made everything easy for me. I had to start with the remedial classes, coming back I had been more than 10 years since I had been in school. So they started me with the remedial classes in math and English, and that really gave me a good start. So they helped me through that, and then I transferred over to, at the time it was called University of Southern Colorado, which is now Colorado State University. So I got my bachelor's there and graduated cum laude, which was surprising since I struggled so much at the beginning. So I think PCC just really helped give me that foundation that I needed, and got through those courses, and then I was able to take the advanced standing course at Fort Collins. So I did that for a year and got my master's there. I am currently retired or semi-retired. I retired 2 years ago from Department of Justice, Federal Bureau of Prisons, retiring out of Philadelphia there as a reentry administrator. So after 20 years there, I was looking for volunteer work, and I met some people at WellSTART, and they knew that I was still looking to do work in the community and said there was a real need for supervision for students. And that excited me. That was something I was really interested in. I had currently taught classes at PCC in social work, and always thought that I wanted to help and give back to those students for all of the help and support I had. Through the FEDC and WellSTART, I was able to start private practice last year. I wanted to see maybe 6 clients a week and start and just get through that process. And they introduced me to a student that was a LPCC, which is a licensed professional counselor candidate who also wanted to do private practice. So anyway, a year later, we opened an office in Canyon City, and she's currently doing her practice there. And somehow I got up to 20 clients a week, because unfortunately in mental health there's a big demand for therapy sessions. So kind of scaling back on that a little bit. And today I actually interviewed with another student from the university that wants to have supervision. When I talked to Jennifer, she had said that she looked for 3 years for someone to do supervision for her. And then this student today was also saying that, you know, without having a supervisor that could see her in the agency she's in now, she would have to move agency. So it's working out really well to be able to make it manageable for people, because a lot of times they're trying to work and go to school and they have to do their supervision, and it's really overwhelming, which is why a lot of people give up on it. There's just a lot of barriers. So to me, behavioral health encompasses the individual, the community, advocacy for clients, really looking at the biopsychosocial needs of people, people in their communities. And so it's just not seeing the individual or their families. It's part of that community networking that I think is what behavioral health encompasses for me. Working with the medical system as well. We get a lot of referrals from the hospitals and seeing clients, so just that collaborative effort. You know, what I find most rewarding is helping people, being there as a support, working with other agencies to provide services for families in our community. The careers that are available here are numerous. You can work anywhere with the courts, advocacy, domestic violence, drug treatment, work with children, elderly. So in all of the years, I've been doing social work for 30 years, and so it's hard to believe that I've worked with as many agencies in town that I have, and all working together, like I said before, collaboratively. And each agency that you learn from connects to the next agency that you go to. And so what I like about working in a rural area is that you're a generalist, that you really have a lot of experience in many different areas. For students that are interested in behavioral health, I think that there are just so many opportunities that if you're a person that wants to help people and you find that rewarding, there's so many different agencies that you can work in, so many different career paths. We can work as school counselors, we can work in the nursing homes, we can work in hospitals, we can do private practice. So there's really, like I had said before, working with the individual, working in the communities, working as part of legislation, advocating for people. So that's what I like about it the most. As I said, I'd been working in this field for 30 years, and I never get tired of anything. I'm just wondering, like, what's the next thing that's going to become available to me? If you're interested in finding out more in the field of behavioral health, or I can help in any way at all, please feel free to contact me at Stay Well Counseling.